Welcome again to another episode of Ask Your Doctors. Remember, this is an audience-based broadcast where the audience asks questions and we get the doctors that are resident as well as our visiting experts to give you the answers that you're looking for. So please feel free every time you bump into our social media pages to go in there and ask the questions that you would like us to answer in the next episode. Once more, I am with our regular guest, Dr. Jez Badi, who is an interventionary radiologist. Please forgive me, these are big words. So now and then we will have a problem saying them. In any case, welcome, sir.
Thank you.
Nice to have you again.
Thank you for the invite.
And today we have a good treat because we have another expert, a young black lady who is a virologist, I'm meant to say. And she is coming to help us debunk the myths around vaccines and possibly the virus to a certain extent, and some of the social questions that you may have for us regarding how you perceive vaccines and so on. And without much ado, let me introduce Dr. Bonolo Mashishi. Hi, ma'am.
Hi, thank
How are you?
Thank you so much for
All right,
having me.
thanks for
Yes,
visiting.
I'm good. Good.
Okay.
Good to be here. Thank you.
Good, good. Can you explain to our audience what you do?
So, as you said, I'm a virologist. So, a virologist is a discipline. Virology is a discipline in infectious diseases. So, if you don't know what infectious diseases are, so we basically deal with bugs. Basically, bugs, bacteria, viruses, fungi. And my focus is specifically on the viruses.
Okay.
So my job really is to manage viruses. We look at how they interact with the human body, how they cause disease in our bodies, ways in which we can prevent them, such as vaccines. We also, importantly, and which is the bulk of what I do day to day, how we test them and identify these viruses in our bodies. So yeah, that's what we do.
Okay. I suppose yes, doc.
Awesome. That sounds very interesting.
Very interesting.
We're looking to learn a lot from you.
Thank you.
Yeah,
Thank
I
you.
suppose the last years were the highlight of your past 15, maybe, with the amount of work that's there with COVID.
No, certainly COVID came at a very interesting time. It did kind of shake our world up as virology. Yeah, I haven't been in the game for that long though.
Okay.
But yeah, last year was great. And it is great still.
Great for your work, but sad for all of us, eh?
Definitely,
In
definitely.
any case, without wasting much time, let me do the audience-based thing that we do where I go to the questions. So
Okay.
there's a lot of challenging questions from our audiences. Some will come in the form of voice notes, some will come mostly from social media.
Okay.
Yes, it says here, hi doctors, Caesar from Krugersdorp. Now that we have our COVID vaccines, I hear we have to take booster shots. This is a very interesting one. I also want to know about it. Please educate us more about why we need to take booster shots.
Thanks, Cesar. That's really an interesting question, and I know it's been doing rounds on social media as well. But just to start off, I think the issue around boosters is not unique to COVID. I think people tend to still get a bit sensitive when it comes to COVID vaccines, but it's certainly not a new phenomenon. We see it with other vaccines. So basically how vaccines work is that they prepare your body against a certain bug, right? So they protect you to a certain level. Unfortunately, some vaccines are only protective for a short period of time. So after a while, you start getting waning, what we call waning immunity. It starts wearing down. So a booster shot basically is kind of like a top-up. You know, you top up your airtime, so you top up this vaccine to maintain your protection to a certain level as well.
Okay.
Yeah.
Okay. Oh, that's awesome. It's like we're glad to know because people are always thinking that when you have to add on, it's because the other one was weak. Only to understand that actually it was stronger. It was still strong. So that it needs a top
Yes.
up.
No, also just to explain the difference between what we call additional doses or extra doses versus a booster dose.
Yes.
Booster doses are given to people who were previously vaccinated and they were protected. So it's not like the vaccine didn't work for them the first time. And then that booster dose, like I said, just maintains them. Then there are some people where the vaccines, because their bodies can't respond very well, don't respond very well, so they need additional doses, what we call additional vaccinations,
Yes.
to get them to that initial level. So boosters, you had a level, you waned, and then we're going to top you up. Additional doses, you didn't really reach the initial levels, so we need to just kind of help you to get there.
A very important clarification. Thanks for that additional info, Doc. My question regards children,
Okay.
and there's also sensitivities around children.
Certainly.
So the audience is asking that why are children only taking one shot, and why don't they need consent from their parents for their COVID vaccine?
Yeah, it is a very sensitive issue. Especially because, I mean, again, when COVID started, there was, widespread information about how children are safer than adults when it comes to COVID, and the disease that we see in children. But certainly that information has changed. And so the requirement for children to get vaccinated, it's really evidence-based. We see that children are dying from COVID, although not at the same rates and levels as adults. So it's important to understand the need for why we need to vaccinate children in the first place. And when it comes to the consent issue, and I'll start off with that one first before I address the one dose versus the two doses. In South African law, I mean, the legal age for children to give consent for medical treatment is age 12, but that needs to be contextualized as well.
Yes.
Children also need to be mature and understanding of what they're getting themselves into, and children mature at different ages and at different rates. So it doesn't
Yes.
mean that if you're biologically 12, then you're good to go. You still need guidance from your parents. You
True.
still need your parents to act in your best interest, to provide you with information and help you understand so that you can make the best decision for yourself. So it certainly does not isolate parents from this process. I think a lot of parents are also still feeling a bit anxious about,
Yes. Definitely.
I'm just leaving my child out there, but no, you're not isolated in the process. It's just so to protect children's rights as well in accessing
While you're there,
healthcare.
Doc, I take it's not going to be a situation of most children will go on their own anyway.
Most children are not going to go there on their own anyway, yes.
And I take it most parents will give consent and go with them. It's not going to be as hostile as every child is just bouncing in there.
No, children are not just going to run away
Yeah.
from home and be like, I got my card and certificate here.
I
no.
believe this is in accordance with the Child Act.
Certainly, yes.
But-
The law is there to protect the rights of children as well. So because it's also a very controversial issue, it's there to ultimately protect children so that they can get their share.
The first time I heard about it was in relation to termination of pregnancy.
Yes.
Yes,
When it
yes,
started, but I
yes.
suppose that's a topic for another day. In any case, are you
Yes.
okay, Doc?
No, I'm
Um,
fine. I think that sort of rests the issue with
The consent,
the consents and the consent as legal guardians, as the recognized legal guardians by the state,
Yeah.
so that they know that they will be involved in the process from the beginning to the end, and they should not be apprehensive
No,
about
certainly.
their children getting
Certainly.
the vaccine, and that they got the vaccine. It should be safe enough for the children as
For
well.
the children,
And
yes.
thank you for bringing that forth, so that we can then rest emotions that are restless.
Yes, I think all paid. So, and then the question regarding the 2 doses versus the 1 dose. So again, COVID is a science on its own that constantly keeps us on our toes. We are learning as information comes forth, and every day new information comes through. So children and adults, certainly not the same. So how the virus, not really the virus, but the vaccines behave in children and adults may be slightly different. There is enough evidence to show that the vaccines are safe, but there are concerns regarding potential risk for the children, especially in this age group 12 to 17. And that risk comes particularly after the second dose. So most countries are actually recommending and opting that we rather protect our children to some degree with the first dose, rather than, you know, watch and see what potentially may come after the second dose. And certainly that does not mean that we won't opt for a second dose later on. It just means right now, with the information that we have, that's the decision that's going to be taken.
Does autoimmunity in the children, the development of which is usually regular from pathogens or what you call infective agents, have anything to do with that? It is okay because their immunity will be working already towards the virus?
No, so the risk is not really related to the autoimmunity, but it may be a vaccine-induced cardiac problem that may be triggered in that sense. So the autoimmune responses that we will typically see will follow after natural infection. So if you do get COVID rather than the vaccine itself. Yeah.
Okay.
So it's work in progress.
It's work in progress, basically. It is a journey.
I feel like I shouldn't. I'm glad I'm not sitting in your seat because all this is speculative. And the thing is, if I know that when I'm sitting with a bunch of friends or family,
Yes.
they come to me and say, "You're the doctor. Tell us." And I'm thinking, and obviously, there I'm allowed to speculate. But I'm glad now that you are being fired upon in the firing line, and thanks for the goods you are giving us so far. Why is government still making us have access to J&J and Pfizer only when there are other vaccines around?
Yeah. So when it comes to vaccine access, sure, it's not really a straightforward answer. I'm not going to lie. It's not a straightforward answer. And again, there are lots of considerations that need to be made. What happens elsewhere does not mean it's applicable to our setting as well. So as you know, vaccines work differently in different people. So you need to answer the question how well it works for your people. And that requires a vigorous exercise. So you pick and choose based on those sort of questions, and also the virus also reacts differently. The one time there's a Delta and the Beta is here, and you know, vice versa, and we've seen that the vaccines don't always respond well to these viruses. And also there've been issues about the logistics of the vaccines.
Okay.
How they're transported, how they're stored. Do our conditions in South Africa allow for us to have certain vaccines, yes or no? You know, access is still a bit of an issue with vaccines, the cost of these vaccines. So it's not really as straightforward as to why certain vaccines are here and others are not.
So it's got nothing to do with Western indoctrination versus China and Russia. You wouldn't know anyway, you're not a politician.
No, I'm not a politician, but you know, those issues are there, but yeah.
Okay.
Yeah.
So also it's an issue of regulation. I believe there was a point in the last 6 months where someone had not even applied for those two, Sputnik and the other one, to be authorized to be provided in the country.
Yes.
And the authorities were saying someone should apply.
Yes.
Then we will look at it and authorize it.
Yes, and certainly that is the process to be followed,
But the people want the answers now, you know.
That's the thing. That is the thing. People are always anxious. People are always needing answers now. Or yesterday even.
People always feeling like they should change,
Exactly.
like we're not getting the best quality of work and
Suspicions,
Yeah, that's fine.
paranoia.
That's fine. Moving along, Doc, another question comes. They say, hello, doctors. Has enough research been done about the vaccine, the coronavirus strains, other strains of the coronavirus? And will vaccines prevent future animal to human virus transmissions? Has enough research been done about the coronavirus strains that are coming through? And will there be prevention of transmission from animals to human in the future?
Yeah, I love this question
Yes.
because no, because
Confusing.
this is an area of interest personally for me, because we just it's always a very interesting question, this one. So we do know that this current coronavirus has some animal origin. But even though the viruses in animals and humans may be similar, they will behave differently. So what happens in animals is not necessarily what's going to happen to us as humans, as we've seen with many, many viruses. And the vaccines currently are there to help human-to-human transmissions. So it's not a one-size-fits-all thing. So when it comes to limiting spread of viruses that affect animals that could potentially affect us as humans, it's an ongoing exercise. We monitor this all the time, not just this coronavirus, but other viruses as well. And the best thing always is contact. You know, if we limit the contact between animals and humans, that's the best way we can prevent it. I don't think there's a vaccine that could certainly do that. Yeah. I hope that answers the question. Yeah.
I hope
So,
that, yeah.
so it's still on, eh?
Yeah.
The moment something hits us in the future, we are on. We're not sure what's going to happen.
We're not sure
That's
what's
what
going to
you say.
happen. Yes,
So we
no.
must stay away from things that we're supposed to stay away from.
Yes,
Especially
animals
eating
are.
animals that we shouldn't be eating.
Yes, yes.
Okay.
That's always an issue.
Yeah, no, that's a tricky question. It's very speculative, and anyway, I noticed that most of our questions come from people in the Gauteng area. This is a national show, guys. We have to be accepting questions from everywhere. In future, it'll be an international show. Please feel free from Lusikisiki, from Kwakwa, my hometown, to give us questions. You know, it's our show. We must interact. And here is Elizabeth from Bryanston. She wants to know why her GP doesn't have the vaccine, because she says he has my history. He will know what I might react to, and I'm more comfortable with my GP than going all over queuing up and whatever. And that could also deal with the queues. It's a policy question. I'm not sure if you are confident enough to stray in that area. And also, my follow-up from that one would be, why are the local pharmacies not so highlighted as potential sites for us getting vaccinated? My local pharmacy, why are the big guns or being the only one getting the money?
That is an answer I don't have.
Okay, fine.
Sorry.
And then, but in any case, does anyone, Doc, if there are any local pharmacies that are doing the vaccines?
Not that I know of. I know that the sites have been pre-chosen because, as Doc has said, it's because of logistics of transporting the vaccines, make sure that they are distributed at the time that the vaccine that are delivered, according to the bookings on the online booking system, so that there is no expiration or denaturation of the vaccine. Denaturation meaning that they become less effective because of the temperature environment they find themselves in. So that process is controlled tightly because we're dealing with things that can easily denature, easily become destroyed and not be effective. And we want the vaccine, this vaccine in particular, of COVID-19 to be effective because we want to reach herd immunity.
I'm not going to argue with either of you, but that still does not exclude the local pharmacists. They are as competent. Let's not go to it. They are just as competent, but we don't know. Maybe one day we must get an expert that's going to explain to us why the policy was this came and clicks.
In principle, I would agree that it should be everybody partaking in the distribution, distribution and giving of the vaccines. But as you would say, maybe somebody who's got the deeper knowledge as to why it was done that way initially. And actually, initially it was done with big centers. If you would remember, in my big center, it was one of the first big centers to give the vaccine. Then it was decentralized from the big centers to then the
pharmacies.
pharmacies.
I suppose it's work in progress.
So that too is a work in process. I'm sure when it gets, and when the need arises, because they say necessity is a mother of invention, when the need arises, it will get there. But at the moment, we don't know, and we don't know what the policy information is around that distribution and giving of the vaccines.
But fortunately, some local clinics do offer it.
Yes. I think with the distribution of the vaccine, issues of equality come into play. I think that's been at the forefront with so there's been a lot of control of how the vaccines are distributed and who's actually distributing that. And we in South Africa, unfortunately, still have issues around equality. So I think that's why it's largely centralized to government, and government being the ones to choose who gets to distribute the vaccine and how that should be done. Yeah.
All right.
Now, awesome, Doc. As we go forward, debunking the issue with regards to COVID-19 and vaccination and trying to get to herd immunity, we have another question coming from our social media platform saying, hello, doctors. I am Thabo from Cosmo City. Can I get vaccinated when I have a rare condition?
And when I saw this question, I immediately said, Doc, but we can't allow this question. What is a rare
What is a
condition?
rare?
So I said, he said we must do it. It's an audience member wants to know. We leave it in your hands. If you can do it, you can do it. But it's a very vague
No,
one.
I think it's an opportunity to just educate as well. And obviously, you're right. We don't know what this rare condition is. But when it comes to COVID vaccines, there are very few conditions that are absolute contraindications. And by that, I mean that, you know, you absolutely are not allowed to take the vaccine. There are very few conditions like that, and most of the time you need to just liaise and talk to your practitioner about your condition. We don't know what his conditions are but certainly I don't think it's something that.
So there's not too many rare conditions that are excluded from the vaccine.
They aren't really.
Okay, cool.
Yeah, they aren't
Cool,
really.
And,
yeah.
and even if there is that condition, I would hazard that there will be a delay more than a denial of the vaccine.
Certainly.
In that we need to work out what this condition is,
Yeah.
and if there are other alternative vaccines
Yes.
that we can use
Yes.
so that we can get you the necessary immunity.
Yes.
So it can't be indefinite.
No, we have a lot more options now. So yeah, certainly.
With medical science and the evolving knowledge and development of vaccines,
yes.
we should be having
So
a way to
you'll have
vaccinate
an
everyone.
answer. Yeah,
Soon.
Soon. Don't
Okay,
stay
cool.
away,
No
Thabo.
problem.
Right. So, Thabo, I hope you answered, and that goes to everybody else that's been asking whether they've got a condition that would necessarily remove you from being vaccinated.
No.
So, if you're thinking you have a condition that does not allow you to get vaccinated, the doctor, virologist, Dr. Bonolo Mashishi has just answered, say, it has to be extremely rare, but even if it is extremely rare, there are ways and means of getting around the disease so that if it is a temporary delay, it cannot be a denial, and you'll eventually get the vaccine so that you can get the immunity that you need against COVID-19. Thank you, Doc.
Thank you.
I'm dying to ask my next one.
Go ahead.
Anonymous is
Okay.
talking about that thing that the president mentioned in one of the clips that we got on social media. So we are giving the answer today. The performance one, Doc. Does it affect performance?
Oh, wow.
Okay, let me
these
be
questions
specific.
always- yeah.
Anonymous, okay, I take it Anonymous is a man. He says here, does it affect my performance as a man?
Not that I'm aware of. No, there's no evidence that shows that you know it affects in that regard. No.
Okay, thank
No.
goodness.
Yeah.
Yeah.
So the gentleman can rest assured
Yes.
that if they take the vaccine, actually there was a joke, to be honest,
Okay.
saying that if it comes from Pfizer,
Okay.
it is known for the blue pill.
Okay.
And the blue pill is known to get you to be very robust.
So there's no need to worry.
There
So,
was
so more reason to actually go get the
more
vaccine.
reason to go and get the vaccine. So gentlemen,
Wow.
please rest assured that you will not otherwise be compromised when you take the vaccine. Actually, you will be healthier. Your heart won't be affected because the virus does affect the heart. And you won't be too tired because remember, if you get the COVID-19 infection, you get what we call fatigue, and you are too tired to even do anything. So you won't be too tired, your heart will be pumping well, you won't be having any headaches. As we know, headaches can be reasons why certain processes cannot be engaged in. And now it will be a man saying, I got a headache.
Yeah.
You don't have to have a headache. You will be having the vaccine. So yeah, Doc, I think that was the next one is your question, Doc?
There's long COVID, Doc. Can you tell us about long COVID? Does the vaccine help against long COVID?
So long COVID is unfortunately a complication of COVID, the infection. So when you get sick from the virus, once the virus is cleared from your body, some people don't get relief of their symptoms. Some of them, they continue to persist for months, sometimes longer than that. People become chronically tired, they're forgetful, they have these headaches that just don't go away. And that's more described if you have the infection and you haven't been vaccinated. Certainly the vaccine protects you against that because obviously it limits you from getting infection to some extent. So no, it's not something that's been described for the vaccine, but you will certainly get it if, unfortunately.
Okay, did you get COVID last year? You didn't?
No, I was fortunate enough not to get COVID.
Yeah, I've also been fortunate enough to.
So all these funny things from me can be blamed on long COVID. I haven't been myself really. Okay.
Yeah.
All right. Doc, I think we're coming to the tail end of our questions and answer session. I'll collapse the two together.
Sure.
How long does the vaccine last? People want to know. And why is there resurgence after getting the vaccine? And why are people testing positive after getting the vaccine or after getting the COVID, long after getting COVID and recovering, they're still testing positive? How long does the vaccine last? And why is there a resurgence of the infection even after getting the vaccine?
Vaccines,
So
yeah.
I think those will then summarize the last questions.
Yeah, those are very packed questions, so I'll try break it down. I think first when it comes to getting the vaccine and getting infected, it's important to understand the dynamics of how the vaccines work. So it's all about timing in relation to context, what's happening in the communities. So, if we had to compare getting vaccinated now when the numbers are low versus when you get infected when the numbers are actually high. So when the numbers are high, you're more likely to come in contact with someone who's infected, knowingly or unknowingly so. Compared to now, the numbers are down, you're less likely to do so.
Yes.
So just basic principles, the higher chances of getting exposed, the more chances you are of getting infected, obviously. And that's what happened with the third wave, where we're seeing a lot of people getting infected even after they were vaccinated. So people potentially were vaccinated unknowingly that they were already exposed and infected with the virus. And also the vaccines work. It's not like you get your jab today and you're good to go. They need time to work as well.
Yes,
So you get your jab today, you go back to your community, and then you still get infected. So you think the vaccines don't work as well because it's just so much virus going around in the community at that time. And that's why it's important to always supplement your vaccines with your masks, social distancing, etc., those sort of things. And certainly the dynamics will change now when the numbers are low. So those are the scenarios that we were seeing with regards
And
to
the
infections.
variants too play a role.
The
in
variants
that
play a role
The vaccines may be not as effective against
certain variants.
as
Yes.
the mother virus.
Yes.
So it is always important to respect all protocols.
Yes.
If you don't have to go out, don't go out.
Don't go out.
Wash your hands, sanitize, keep your mask on all the time, and not go to crowded areas.
Yes. Windows open
yeah,
all
windows
the time.
open.
Yes.
There was one that I think you said you probably would be able to give an overview on with regards to employment, especially in large organizations, and them insisting, maybe wanting you to get vaccinated because of possibility of transmission from the unvaccinated because of the viral loads. Are you able to give us a quick overview?
I think that's been a very interesting debate to see unfold in the media and also in literature when you're seeing policymakers and how they come to the decision. And it's not a straightforward yes or no answer, but it's about striking a balance, respecting individual rights to health, but also balancing that against public health, because we are in a pandemic.
Yes.
It's not a normal scenario. Certainly, people can't be forced, but you would try to engage with one another as to what your reasons are for not wanting to vaccinate.
Yes.
And there's no such thing as an invalid reason. Everybody has a reason. And it's about understanding those reasons and trying to debunk some myths and misinformation if that's the case.
Yes.
There are medical reasons for people for not wanting to get vaccinated. And certainly, I mean, international regulatory organizations don't encourage people to be forced to get vaccinated, but they do encourage that people understand the consequences that they face of not being vaccinated,
yes.
not only for themselves, but those around. And it also goes into work risk assessments in the workplaces. Vaccines are not the only answers. What are employers perhaps doing to lessen the risks the employees may have of contracting COVID at work?
Yes.
So those are the things that also need to get into the discussions as well.
So it's an interplay, synergy,
Yes.
and complement
Yes.
between the worker,
Yes.
and the employee and the employer, as well as the workspace.
Workspace, yeah.
And with regards to all other proclaimed protocols to try and make sure that you lessen the transmission.
Yes, yes.
Doc, it's been lovely having
Thank
such
you.
awesome information, brilliant information that is evidence-based, coming from a person that is knowledgeable in the field, a virologist or a viral pathologist. And we wish we had more time so that you can inspire a young person out there who wants to take up space. I hear young people would want to take up space, and concretize this knowledge, following in your footsteps and doing much more also to help stave off the pandemic or future pandemics. Thank you very much, and thank you for your answers.
Thank you. Thank you so much for having me. It was certainly a pleasure to be here, to engage with everybody. Thank you to everybody out there for your questions. It always is a great opportunity to engage with people, to educate, and yeah, thank you for the space. Thank you very much.
Thank you.
Thanks for the treat, Doc. Thanks, Doc.
Yeah.
I knew that he would compliment this very well. And guys, let's look forward to more questions. Remember, it's an audience-based broadcast, so you have to go to our social media pages. We are on Facebook, we are on Twitter, we are on Instagram, we are on YouTube. Please follow on. We are also on our website. Most importantly, there's a lot of articles that we have tried to summarize on our blogs. So go to the articles, pick up some important topical topics that you can answer, we can answer from, and you bring up the questions from the topics that you find everywhere, whether it's on our whichever social media pages. Then we will come up with the experts, and most of the time we'll bring the experts because we don't know everything.
Yeah, yes, very much so. Thank you for the invite, Doc, and thank you for the vote of confidence. South Africa, we are here for you. Ask your doctors, get the answers. Do not go to other places to seek information. The experts are here. Doctor is here. We are here to answer all your questions. And thank you very much. Thank you for being with us.